So basically what we're going to be showing you right now is an example of a patient who's getting a relatively high dose of Infliximab every 6 weeks, but is clearly not getting a trough that would be considered appropriate. So let's take a look at that patient. If we add in the dose that's being administered, you can see that's a 10 milligram per kilogram dose, and that the dosing interval is every 6 weeks, but the observed trough is quite low, and we're hoping to bring it up to something higher like 10. And what we're hoping to see is alternate dosing regimens that should put that patient at the target concentration. And as you can see here, we get an individualized nomogram figure, and we provide the different dosing intervals at different mg per kg dosing. So you can see that the dose interval, for example, for a 5 milligram per kilogram dose is extremely short. But if you go to a 10 milligram per kilogram dose, it's still shorter than the 6-week interval, but these are going to help you get this patient to the trough that you are looking to obtain. Basically, if that patient then returned later for another visit and you had drawn another trough sample and you decided on the 10 milligram per kilogram, but now instead of going every 6 weeks, you're going every 3 weeks, and you see an observed trough that's fairly close to what you wanted, about 9 micrograms per mil. And if you retest it at 10, you'll see that the results are coming back to be quite similar to what you would have expected. Basically, it's showing some of the stability of the system for a repeat assessment of the patient as long as that patient's condition hasn't changed, significantly. One of the important questions is often whether or not it's possible to extend the dosing interval. So if, for example, a patient is getting dosed every 4 weeks, and seems to be stable, is it possible to extend the dosing interval so that the patient doesn't have to make as many trips to have an infusion? And so if we take a patient who weighs, for example, 80 kilograms, and their dose is 400 milligrams, and they're getting dosed every 6 weeks, and their observed trough is 12, and we decide that they could go to a lower value, such as a 7 microgram per mil trough, which is still considered appropriate, we should see that we should be able to go to a longer dosing interval for some of these different doses here. For example, if we went to a 10 milligram per kilogram dose, we'd get a much longer dosing interval for that patient. Even staying at 5 milligrams per kilogram, we could go to a longer dosing interval and maintain that patient at an appropriate trough level. So the patient would be able to have less frequent visits to get drug. This software is also applicable to pediatric GI patients who are taking Infliximab. So if we take a younger child, such as a 40 kilogram child, and they are receiving a 200 milligram dose, which is 5 milligrams per kilogram, a dosing interval of 6 weeks, and we have we have an observed trough of 5 micrograms per mil, and we'd like to bring it up to 7 micrograms per mil because that's considered a reasonable level. Then we can find a dose even for this child. And you can see the options listed here, which will give you several different options for dosing intervals for this patient. And one thing that you may have noticed is that every time the nomogram comes up, you can see it's changed for every patient. These are not standard nomograms. They are individualized to the patient. So there's a couple of things about these nomograms that explain why it can be so difficult to find an appropriate dose for a patient. The shaded gray area in this nomogram is the half-life of Infliximab that is listed in the package insert. The effective half-life that you're looking at below is actually outside that interval, and you'll find most patients, in fact, are outside the interval. They either have a shorter half-life or a longer half-life. And this is one of the reasons why it can be very difficult to determine a priori what an appropriate dose and dose interval is. Another strength of this particular package is it does give you the effective half-life for that patient. And the effective half-life can actually be used to help justify the dosing interval that you've selected, because the drug will go to a much lower level in 3 to 4 half-lives.